Hi guys. Okay, so I am presenting serratus anterior, and this muscle is really prominent with superheroes. I remember um our popular boxer Manny Pacquiao, right? He always have hypertone, like good or well defined serratus anterior. Um, can't think of anything else, but usually if this is you know well worked or well, how do you call, they sculpt it well to make it really well defined. It will give that a look when guys like to have the six pack, right? They all sometimes, and then the guns, the bicep, and also the serratus anterior. This is mostly the third they wanted to develop, and the fourth is their pectorals, right? So I'm gonna be reading the notes here. So always well developed on superheroes. See, I think that's the reason why I said that. And then the serratus anterior lies along the posterior and lateral rib cage. Its oblique fibers extend from the ribs underneath the scapula and attach to its medial border. So most the anterior is deep to the scapula. Latissimus dorsi is, or sorry, pectoralis major. However, the portion of the serratus below the axilla armpit is superficial and easily accessible. So this muscle is unique in its ability to ABD, abduct the scapula, making it an antagonist to the rhomboids. Okay, so they are antagonists to the rhomboids. Palpating along the sides of the ribs can tickle, so use slow, firm pressure. Also, if you're accessing the right serratus, it may be easier to stand on the left side of the table. So the action of the serratus anterior, we're having here the view, okay, and the lateral view of the serratus anterior, okay. It does, when the origin is fixed, okay, so ABD abducts the scapula, it upwardly rotates the scapula, it also depresses the scapula, and it holds the medial border of the scapula. Okay, just make sure it's recording against the rib cage. And if with the scapula fixed, may act to elevate the thorax during forced inhalation. Okay, the origin is at the external surface of upper 8 or 9 rib. Okay, see this one. See, when the origin is fixed, it abduct the scapula, right? It abduct the scapula, whereas the rhomboid adduct the scapula, right? And also depress the scapula, right? And also hold the medial border of the scapula against the rib cage. So those are when this is fixed. When these are fixed, right? Whereas if this the insertion anterior surface of medial border of the scapula, right? If that is fixed, it may act to elevate the thorax during forced inhalation. Okay? So this is really important for us to remember. Okay? So the nerve innervation is the long thoracic, 6'5", C6, C7, and C8. So looking at the image here, origin and insertion, right? We have established that earlier. Now we're heading to this image. We're also establishing the muscles being seen in the anterior view, right? You can see this is the external oblique, pectoralis major, and then pectoralis minor is a deeper muscle, and then serratus anterior, and then external oblique. Okay, and an internal oblique is deeper muscles. So hopefully I can. Okay, yeah. So I'm gonna try to do 10 minutes. Okay, so the serratus anterior. So having your client in a supine position. So you isolate the location of the serratus by abducting ABD, the arm, slightly and locating the lower edge of the pectoralis major. Then locate the anterior border of the latissimus dorsi. See how the therapist is isolating the serratus while your partner reaches his hand toward the ceiling. So you see that? This is a bigger image of what the therapist is actually doing. This is the lateral border of the scapula, and right? So when you use your serratus, you're doing a push-up, throwing a punch, pushing open a swinging door. And we have the image here. So the pectoralis major is most, where the chest wall. That's why this is considered a sensitive area for manual therapists, right? Aside from the consent, overall consent, we need additional consent, whether if it's a woman or a man, right? Because pectoralis major and serratus anterior, my apologies, are sensitive areas. Okay, the breast is essentially made up of subcutaneous fat and is primarily supported by suspensory ligaments connecting the skin with the deep fascia over the pectoralis major. Although it varies widely in shape and size, the breast generally extends inferiorly from the second to the sixth rib, medially to the sternum, and laterally to the anterior axilla. Okay, nearly 2/3 of the breast covers the pectoralis major, while the inferior lateral aspect covers the serratus anterior. So see if you notice in here, right? So for let's say for breast massage, this has to be covered, and we can have access to that area. I didn't go though because I don't want to be a body when I was in the program. Okay, so I am going to have another page. We are at page 88. Again, this is trail guide to the body. So partner side lying. So the therapist curling his fingers or her fingers under the medial border of the scapula. So turn your partner side lying with his arm at his side. Locate the medial border of the scapula to access the insertion of the serratus anterior. Curl your fingers beneath the medial border and through the trapezius and rhomboid fibers onto the beginning of the subscapular fossa and explore the area where the serratus attaches. Okay, I'm just going to be reading this area here. So the serratus anterior plays a different role on a quadruped than on an upright bipedal human. Okay, quadruped has 4 legs, okay? Just FYI. So for us, the serratus is primarily responsible for ABD abducting the scapula or resisting a push against the shoulder. Okay, so but for a 4-legged animal such as a dog, right anterior view, which carries part of its body weight on its front legs. The serratus muscle, serratus ventralis, and quadriceps form a sling from the scapula to the thorax. This cradles and supports the weight of the trunk and stabilize the limbs against the thorax. Get down on your hands to do a push-up and you will see and feel how this position forces your serratus anterior muscles to function as a dog would. Okay, so keep that in mind while doing a push-up. Now I'm going to go ahead and tackle a little bit or present the sternalis. It's not really common or you don't really hear much about it. So it is, the pectoralis major, the rectus abdominis here, right? That's where it's present in roughly 5% of the population, right? Just like some people doesn't have that palmaris longus, right? The same concept that some people is only presented with 5%. So the sternalis is a thin, superficial muscle lying on the sternum. Its vertical fibers run from the manubrium down to the level of the 7 costal cartilage. The function of the sternalis is unknown. Palpate the surface of your partner's sternum and explore for a sternalis. You will feel if you have this. Okay, so you could also see that in the anterior view. And I'm gonna have to do another video with pectoralis major, minor, and subclavius. I'll see you guys.